good day. My name is Catheterization from BSN 12G, and for today's video, I will be performing the perineal flushing. So first thing that we need to do is to prepare all the materials that we needed, and then let's do the hand washing. So as you can see here, I already prepared the materials that I will be using in this assessment. So first is the kidney basin. Since I don't have that kind of materials here in my end, let's just pretend that this is a kidney basin instead. Next is the the cotton balls, which is it has 9 pieces cotton balls. This is the dry cotton ball, and this is the soaked in cleansing solution. The next is the 2 forceps. We actually need the working and the pick-up. So this is our working, and this is the pick-up forceps. Next is the perineal pad. Then the gloves, the surgical gloves, the bedpan, the newspaper. So this newspaper will serve as the cover for the bedpan. And lastly is the draw sheet. So since I don't have that kind of materials as well, let's just use this instead. So after preparing all these materials, let's go ahead and do the hand washing. So after we do the hand washing, let's go ahead and properly introduce ourselves to the client, and then afterwards let's verify the client's identity and explain to the patient what's the procedure or what's the assessment all about. So the rationale for this is that in order for them to understand and gain the cooperation and the trust as well. So next is that let's screen the patient using a curtain, or lock the door if it's a private room. So the rationale for this is to provide privacy and comfort to the patient. Hi, good day ma'am. My name is Catheterization, and I am your attending nurse for today. So may I know your name first, ma'am? And may I know as well your birthday, please? So what name or what kind of name do you want me to call you, ma'am? Okay. So I just wanted to inform you that we're going to assess, or we're going to do the procedure of perineal flushing, wherein we're going to cleanse your genital area. And the purpose of this is to remove the normal perineal secretions or odor, and then it will also prevent for any contamination, or prevent any infection or contamination from your rectum. Alright? So do you have any questions, ma'am, or clarification that you wanted to address before we start this assessment? Okay, that's good. And how about this room, ma'am? Do you want any changes on this? No. Okay. So let's go ahead, ma'am, and we're going to start in a bit. Okay. Thank you. After we introduce ourselves and we explain the procedure to the patient, let's position our client into a dorsal recombinant. So the rationale for this is that in order for the patient to be more comfortable when we do the assessment. Then next is cover her body and legs with a bath blanket. Place the rubber sheets or draw sheet and bedpan under the patient's bottom. So the rationale for this, or for the rationale why we need to place a draw sheet to the bedpan under the patient's bladder is to prevent the bed from becoming soiled. So good day, ma'am. Since I already explained it to you what we're going to do, the first procedure is that I will be putting the bedpan and the draw sheet under your buttocks, and then I will be covering you with a bath blanket. Is that okay with you? All right, that's good. So I will position you, ma'am, your feet. So next is that we need to drape the blanket. So the lesser the exposure, the lesser the embarrassment for the patient. So we need to cleanse, or we need to flush the perineal area with a warm water. So the rationale for this is that the warm water can soften the perineal area or the perineum, and then it will also give comfort to the patient. So next is that we cleanse the external genitalia starting from midline of symphysis pubis down to the anus. So never retrace a stroke. So the rationale for this is to prevent contamination of the area. Alright, so this is our working forceps, and we need to get one of the first cotton ball that is soaked in cleansing solution. So from symphysis pubis down to the anus, then discard. Next is with the second cotton ball, cleanse starting from mons pubis on figure of 7 by way of external labium towards the anus. So we're going to still get the second cotton ball and do the figure of 7. So start it here, then down to the anus, then discard. Same goes with the third cotton ball, on the other side, figure of 7 down to the anus, then discard. So the rationale of that is that secretions that tend to collect around the labia minora facilitate bacterial growth. So the next one, which is the fourth with the fourth cotton ball, cleanse starting from mons pubis in figure of 7 by way of internal labium towards the anus. That's here, which is the external part, down to the anus, then discard. Same goes with the fifth cotton ball. The other side, figure of 7, down to the anus, then discard. Next is that for the sixth cotton ball, with another cotton ball, cleanse the groin starting from groin up to the thigh. So use another side of this same cotton ball for near groin. So that's the sixth cotton ball. So from a zigzag pattern, up, down, up, down. So discard. Then the other one, which is the last, the next one, up, down, then discard. After cleaning it with the cleansing solution, we need to flush the perineum thoroughly with sterile warm water. So this is our sterile warm water. Cleanse it thoroughly. So using the 7 dry cotton balls dries the perineum with the same stroke as what we did earlier. So the first, from symphysis pubis down to the anus, then discard. Second cotton ball, do the figure of 7 from the anus and discard. Next, which is the third cotton ball, same goes with the discard. The fourth one, and discard. Then the other side, then down to the anus, then discard. So for the groin, from up to down, up, down, up, down, up, down, then discard. The other one, which is do the same one, down, up, down, up, down, up, down, then discard. So we need, since we already cleanse, or we already dry the perineum or the perineal area, we need to remove the bedpan gently and turn the patient to side. To dry, if necessary, takes one cotton ball and cleanse one side of the buttocks, then clean the other side of buttocks and dry both buttocks. So we to dry it, discard, then the other one, discard. So the rationale for that is to provide comfort to the patient. So turn the patient on her back and her comfortable. Sprays with antiseptic as needed. So the rationale to that is to promote healing. So puts the perineal pad with an up-down motion as needed. Alright, so we're going to put the perineal pad with an up-down motion as needed. So the rationale for this is to prevent contamination of vagina and urethra from anal area. So thus, after the care of the materials used, remove and discard the gloves and perform hand hygiene. So we're going to record the treatment done to patient and any unusual findings such as redness, excoriation, skin breakdown, discharge, or any drainage, and any localized areas of tenderness. So the rationale for this is for documentation purposes. The procedure was done in means of communication. hi, good day. My name is Catheterization from BSN 12G, and for today's video, I will be performing the catheterization. So first thing that we need to do is to check the physician's order, and the rationale for this is to note for any complications or any specified infections that was being noted by the physician. So we're going to check it. So next is that after we check the physician's order, we need to do the hand washing. The rationale for this is in order for us not to spread any microorganism to our patient. So after we do the hand washing, we must explain to the client or to our patient what's the procedure or what's the assessment all about, so that they can be able to understand and cooperate to us as well. So the rationale for this is that they will be able to give you the trust that we needed, and as well as the cooperation that, as I've said earlier. Next is that we need to prepare all the materials that we needed. So this is the materials that I will be using in this assessment. So first is that since I don't have any kidney basin, let's just pretend, or let's just use this instead. Next is the forceps that we'll be using, which is this one and this one. Next is the lubricant that we'll be using for moisturizing or for smoothing the catheter. The betadine and the cotton ball. And these are the materials which we will be inserting to the genital area, or the genital area of the female. So which are the gloves, the syringe, the catheter itself, as well as the urinary bag. So these are all the materials that I will be using in this assessment. So the rationale for this is that you can save time and effort since you already have the materials in this assessment. So hi ma'am, good day. My name is Catheterization and I am your attending nurse for today. So for today's assessment, for today's procedure, we will be doing the catheterization. So do you have any clarifications, or do you have any further questions, ma'am, that you wanted to address before we start the procedure? Alright, thank you. So but before anything else, ma'am, may I have your name and your birthday, please? Karen Kate C. Gabriel. Thank you for that. And may I check first your wristband? That's great. So by the way, ma'am, for this assessment, we're going to insert the catheterization in your genital area. So let me know if you are agree, or let me know if you are good with that. All right, thank you. So do you have any changes, ma'am, that you wanted to also address specifically on this room? Are you comfortable in your position right now? Okay, that's good. That's great to hear, ma'am. So since you don't have any questions, or since we're all done here, we're going to start in a bit. Okay? Thank you. Go ahead, ma'am, and let's start the assessment. So I will be placing you in a position that allows me to see or check and access your urinary meatus. So the reason for this one, ma'am, or the rationale for this one is for me to the urinary meatus is sometimes difficult to visualize on specifically on women. So it may resemble skin folds and other anatomical landmarks. So these positions allow easy access for me to your urinary meatus. Okay, so I will also draping you, ma'am, with your genital area that I will be using. Okay. So next is that I will be preparing the materials, observing the observing the sterile technique. So I will be using a working glove in order for me to prepare the materials that I will be using in this assessment. Now, I will be opening and arranging the equipment for convenience and accordingly to avoid contamination of sterile items. So using a sterile forceps, cleanse the area using cotton ball with betadine. So is the cotton ball with the betadine. And then discard. Alright, since we already put the new sterile gloves, I will be putting the ice sheet afterwards. So I will next, since we already put the ice sheet, I will be lubricating the catheter for about 1 and 1/2 inches, being careful not to plug the eye of the catheter. We're going to lubricate 1.5. Pick up the catheter for after we lubricate this catheter. We need to pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger at the left or right hand between the labia minora. Separate and pull up gently. So 3 inches. 1, 2, 3. Then we'll insert it. So next is that we need to use a syringe or the 5cc or 10cc to administer sterile water to inflate the balloon. So the rationale for this is to prevent the catheter from stepping out of position. So this. So next is that we need to test the resistance of the catheter by pulling it gently. So the rationale for this is to check if it is uncored properly. Alright, so After we do that, we need to attach the drainage tube to Eurobag and secure with adhesive tape. Place the Eurobag below the level of the bladder. So the rationale for this is to allow the bladder to drain freely by gravity. So we're going to see why. Next is that after we attach the catheter, we need or the Euro bag, we need to attach the catheter to one leg with adhesive tape. Is that we need to assist the client to a comfort position, so to provide the comfort to and safety. So do aftercare and replace all the equipment to its proper places. So next, after we attach the catheter to one leg with adhesive tape, we need to assist the client to a comfortable position. So the reason why we need to do this is to provide comfort and safety. Then next is that do aftercare and replace all the equipment to its proper places. So again, the rationale for this is to prevent contamination. And then I will change the gloves that I just So we need to record all the things that we did to the patient. So the reason why we do, or the rationale for this, is to provide the accurate data for that, or the accurate data in the care of the patient.